Yeah, we are. Hi, good evening, everyone. I hope my audio and video is fine. So, we were getting a lot of messages from the students, sir. The year is about to end and the new year is starting, and we know that the exams are gonna be there in the mid part of the year. So, almost 6 months left for the preparation, and a lot of panicking messages with anxiety are coming up. Sir, what can we do? And how we can utilize these 6 months most effectively. So I thought, okay, let us do this session, and I am being joined by your favorite mentor, Dr. Aditya. Aditya, welcome to the session.
Hi, sir. Thank you. Thanks for having me. And to everyone here, we are here to solve your doubts. We are here to alleviate your anxiety and to ensure that your preparation, like this is one session that's definitely going to be very helpful, irrespective of whatever stage of preparation you are in, and irrespective of whatever platform you are also. To be very honest, right? Doesn't matter your platform, doesn't matter your stage of preparation, doesn't matter where you are from or where you are in your life right now. This is something which is definitely going to help you. So do listen to this and take whatever takeaways you can take and incorporate it into your preparation.
Yeah. Yeah, I mean, we'll make sure that irrespective of the platform that you belong to, this is a session between students and faculty. This is a session where students who are genuinely looking for how they can utilize their 6 months in the most effective way. Right. So Aditya, let us do a role play here. Right. I will try to be a student who has some genuine concern, and I want you to answer them that as a mentor, that who, if you would have been at the same stage, would have been use this. So I believe that we can divide the students at two stages in this preparation. The one is the student who have completed their first reading, and when I am and I want, please make it an interactive session. Please put it in the comment if you want us to answer any of the different thought that we have, right? So I'm dividing the students into two group. Group number one is the student who have completed their first reading. And when I'm saying first reading, this could be either you have done it very well during your MBBS, you have very strong foundation, maybe by coaching or maybe by reading the standard textbooks, or by the combination of both, or after completing the internship, you have attended some classes, or you have learned from your recorded lectures, or you have learned from your own, but you have completed your first reading very thoroughly, or about to complete your first reading. And the second student are the one who have not completed their majority of the first reading by this time, but they are already pursuing it, or you are starting afresh, right? So let us first divide them. If there is a third group, please write it in the comment and we will try to address those, but I think these are the two broad groups. So let us start with the group number one, who have completed their first reading. So Aditya, what do you think is your advice to them?
So I think everyone knows at this point of time that while first aid is important, it's basic is the first aid is for importance of in clearing your concepts, having a strong foundation. And like sir said, this आपने बताया sir, that first aid can be if you have done well prepared well in your MBBS, I would consider that as first aid. कि तुम अपने prof के time पे used to study your standard textbooks thoroughly, या you watch the recorded lectures properly, the main notes आपने पढ़े हुए हैं, या फिर you are someone जिसने during internship did that job or just post internship you have finished that, or you maybe joined Bhatia, or you maybe joined some other offline platform, you're completed with your read. ये first category, but broadly your concepts are fine. For you guys, the single most important mantra right now is the number of revision and how you revise effectively, along with a good MCQ practice, so that on the exam day जो तुम लोगों ने पढ़ा है, देख पढ़ पूरा पढ़ना तो सारे लोग कर लेंगे. Everyone will be able to do one reading after a point of time over a period of 6 months or 1 year. What matters now for you group, for this group specifically, is revision, because revision ensures कि कितना तुम whatever you have learned, A, you retain it, and B, you are actually able to apply it on the exam. आता है पर एग्जाम में क्वेश्चन गलत हो रहे हैं उसका कोई फायदा नहीं है ना. देयर इज नो पॉइंट ऑफ knowing a lot of stuff but on the exam day you're not able to solve MCQs. So your goal now is twofold. One is revising so that you retain, because obviously we all understand the information is a lot. There's definitely a lot. There's 19 subjects after all. And B, you're able to apply that information on the actual exam day, which is why I keep on talking about last 10-day revision. अब करना
Aditya,
कैसे?
I want to mention a point here because I mean I still remember Dr. Bhatia always used to say a point, and the point was that remember exam is not about your ability to read, it's about your ability to recall. And
Recall.
how much you are able to recall on the exam day is the key that where will be your score, right? And this is one of the biggest reason that we say that your fundamentals have to be very very strong. Your first reading has to be very very thorough, because if it's a thorough conceptual reading, the chances that you will be able to recall is
On
far
the
far
exam.
higher in comparison to when I give you a mixture of everything at a plate and telling you कि अच्छा it might have a concentrated content, but your ability to recall that content in the absence of a conceptual knowledge will be very very less, right?
इस
So
इसमें
focus on this.
मैं इसमें एक आई वांट टू शेयर अ वेरी इंपॉर्टेंट एनेक्डोट सर कि फॉर एग्जांपल वन शॉट ले लेते हैं हमारा, राइट. वन शॉट में वी हैव डन ऑल आवर सब्जेक्ट्स इन लाइक आई डू पीडियाट्रिक्स इन 4-5 hours, या फॉर दैट मैटर अश्विनी सर इज एबल टू डू इन अगेन इन 4-5 hours द एंटायर एनाटमी. अब ऐसा तो नहीं है दैट वी टीच आई टीच पीडियाट्रिक्स फॉर 20-25 hours, सर आल्सो टीचर्स फॉर 3-4 days. It is important that you first have that base and then you will be able to do understand one shot properly. अगर वो नहीं होगा तो नहीं. इसका एक बहुत आप द नेक्स्ट एनेक्डोट आई एम शेयरिंग स्पेसिफिकली बिकॉज आप सर मेरे सामने हो. युवराज सिंह ने जब 6 छक्के मारे थे सर, राइट, तो अगर किसी को कमेंट्री याद है, एनीवन रिमेंबर्स द कमेंट्री, इट वाज ऑन द फिफ्थ बॉल, नॉट ऑन द सिक्स्थ बॉल. फिफ्थ बॉल पे रवि शास्त्री ने बोला था, दिस इज द प्रेशर बॉल फॉर ब्रॉड. If this goes out of the ground, then every chance the next ball will also go out of the ground. What he was describing was essentially momentum, कि slowly and steadily आपने खुद को एकदम build up कर लिया. यार, if your exam performance has to be a like a 6-6-6 kind of performance, आखिरी बॉल पे छक्का मार के 6 छक्के नहीं बोले जाते. आपको पहले 5 बॉलों पे छक्के मारने पड़ेंगे. Then on the sixth ball when you hit the six, it becomes a 6-6. That first reading is your first six. अगर पहले ही नहीं मारा तो obviously you can never hit 6 sixes in a row.
Yeah.
उसके बाद the next 2-3 revisions become your second, third and fourth six. And then the last 10-day revision finally becomes your last six.
Yeah.
But अगर पहली बॉल पे छक्का नहीं मारोगे तो कभी भी तुम 6 sixes नहीं मार पाओगे, right?
सोच ही नहीं सकते.
सोच ही नहीं सकते,
हम्म.
राइट. अगर so that is the main importance. Like you have to have a good foundation, and I'm assuming a lot of you have, obviously not for all 19 subjects but broadly for let's say 10 or maybe 12 subjects if you have that good foundation. Now the process is to carry that momentum forward, not lose that momentum. आपने अपनी first read कर ली है, आपको अब उस momentum को carry forward करना है in a way that you're able to recall on the exam day and in a way that you're able to solve MCQs. These are the two main things. देखो, इफ यू समवन जिसने एमबीबीएस में बहुत अच्छे से पढ़ाई की थी, जैसे आई विल टेक माय एग्जांपल, यू आर समवन हु डिड थॉरो रीडिंग इन योर एमबीबीएस, यू आर ब्रॉडली थॉरो विद योर स्टैंडर्ड टेक्स्ट बुक्स एंड एवरीथिंग, लाइक आई रेड रॉबिन्स प्रॉपर्ली, मुझे पता है. एंड अब तुम्हारे पास योर लेट्स से योर इंटर्न राइट नाउ, और लेट्स से पोस्ट इंटर्न, इंटर्नशिप में टाइम नहीं मिला पढ़ाई करने का ढंग से, यू डिड नॉट स्टडी प्रॉपर्ली ड्यूरिंग इंटर्नशिप, एंड देन आफ्टरवर्ड्स नाउ इट्स पोस्ट इंटर्नशिप टाइम. आई वुड डेफिनेटली लाइक मी, लाइक डॉक्टर रजत, आई वुड एडवाइज यू टू ज्वाइन टीएनडी, plain and simple. Like there is no question about that will give you what it will give you, those second, third, fourth and fifth, sixth, because it will ensure that you have a schedule कि अच्छा इस हफ्ते में मेरे को ये खत्म करना है. So it will ensure that you keep on revising the subjects in that scheduled manner. And secondly, because TND is what it is, test, तो एमसीक्यू सॉल्विंग एबिलिटी भी साइड बाय साइड होती रहेगी तुम्हारी, राइट. एंड यू विल ऑलवेज साइमल्टेनियसली फॉर द फिफ्थ एंड द सिक्स दैट लास्ट 10 day एंड लास्ट 1 month में रिविजन, यू विल कीप ऑन गेटिंग द कंसाइज नोट्स एंड द कंसाइज मटेरियल फॉर रिविजन ऑल्सो, राइट. सो फॉर इफ यू आर समवन हु इज थॉरो विद योर सब्जेक्ट्स, रैंक इस बार अच्छी क्यों नहीं है? क्योंकि रिवाइज अच्छे से नहीं कर पाए, or the internship was very hectic, you could not get time to study, like you were thorough in your MBBS but did not get time in internship, or you did study in internship but revision went haywire, but otherwise you feel your concepts are decent. A test and discussion would definitely be something I would advise, and this is not something like इसलिए बोल रहा हूँ क्योंकि I'm in Bhatia, मैं इसलिए बोल रहा हूँ क्योंकि मैं इस प्लेटफॉर्म का स्टूडेंट रह चुका हूँ.
Yeah.
Nothing else.
Aditya, maybe एक बात I will also want to say one thing is the only coaching that I have ever done in my life is also a TND program. Right. So, and one more biggest advantage that the TND specifically is gonna give you is that since it gives you a schedule, you are once again able to finish your course at the right amount of time. For all the students who are messaging about the schedule, we have made a wonderful schedule in this year because every student is finishing TND first reading at different time. So you have a floating schedule of TND, which is a DBMCI live. Now we call it as DBMCI 1, where if you are finishing it in December, you can start the TND in December and it will end in 4 months. You are finishing it in January, you can start in January and it will end in 4 months, and every subject will be done live. So every 4 month there will be a new cycle of live TND program. Their schedules are available on DBMCI One app, and you can visit and you can see them. But please remember, these programs are best for the students who have already completed their first reading.
Definitely
Everybody
no doubt.
everybody has to understand that it's an ideal program. If you have finished your first reading should not be compromised for anything else, right? So now let us go to the second set of students who are yet finishing their syllabus. So I believe that who are finishing their syllabus, they should not get into a FOMO that why people have finished it. The rule is very simple. If you have started early, you will finish early. If you have started late, you will finish late. But are you really late for the NEET PG 2026 exam? Answer is no. I believe that even by January, even by February, you are finishing your first reading, we are sorted. Yes, if I'm gonna go beyond February, then I have to curtail onto my resources for the first reading. And when I'm talking about first reading, I'm talking about all thorough reading of all 19 subjects. But now let us talk about the third, and that is the most vulnerable group, which is a very, very big chunk in today's time. Those who are starting now or have finished one or two subjects at this stage. So, Aditya, over to you. What do you think? What
So,
students should do if they are starting now or at a very, very beginning stage of their preparation?
so sir, I would say that देखो, I'm assuming MBBS में if not every subject, some subjects you were probably strong, some subjects you're weak. If you just have like 5 6 months, like इसमें ही करना है and you have not done anything till now, then obviously maybe you obviously cannot go for a full length offline coaching. And you cannot expect that I will complete all the 19 subject के main videos and revise all the 19 subjects के main notes. यार वो possible नहीं है. At that point of time possible नहीं है. Right? It is definitely not possible. So the better alternative is to shift to revision videos. Right? Now, I always say, sir, that there are two ways you can make concise notes for your exam, which are revisable towards the last part. One way is cutting down कि आपने पहली reading broad की and you trim the notes. Right? You trim the notes down to something which you are able to revise, which TND helps. अगर किसी को लगता है मैं खुद सेल्फ मोटिवेशन है, मैं घर पे बैठ के पढ़ सकता हूँ, you can do it yourself also. तो वो self trimming होती है. The other way to make notes which are actually comprehensive enough for the exams also, but at the same point of time revisable, is that you do revision videos. After doing revision videos, you solve the previous year questions. Previous year question revision video से अराउंड आई वुड से 60% सॉल्व होंगे. 60 to 70% से ज़्यादा नहीं हो पाएंगे फ्रॉम द रिविजन वीडियोस. लाइक मैंने भी बनाई है, आपने भी बनाई है रिविजन वीडियोस. वी नो दैट दे कवर अराउंड 60 to 70% ऑफ PYQs, नॉट ऑल PYQs. योर गोल इज टू कवर एंटायर PYQs एंड प्रीवियस ईयर टॉपिक्स. तो आपने रिविजन वीडियोस की, दोज रिविजन वीडियोस विल बी डन इन अ फास्टर मैनर. After that, you solve the previous year question. Let's say you are able to solve 50% of the questions correctly. Great, आपको उनका concept अच्छा है. जो बचे हुए 50% PYQs हैं, your job now is to annotate those previous year questions onto your revision videos notes. उनके, so you're now bulking up the revision video notes, right? So there are two methods. You trim down. Trim down उनके लिए जिन्होंने first sheet अच्छी से comprehensive कर ली. Now your job is to keep trimming down so that you can revise again and again. Those who are starting with revision videos, your job is to slowly bulk it up. आप रिविजन वीडियोस करो, आप उनमें प्रीवियस ईयर क्वेश्चन और प्रीवियस ईयर टॉपिक्स में. और अगर कोई स्पेसिफिक टॉपिक है जो आपको लग रहा है आपको समझ ही नहीं आ रहा, फॉर एग्जांपल यू डिड मेडिसिन और ECG समझ आ ही नहीं रही, then maybe you can give those 2 3 hours to ECG from the main videos. You can do that, right? Pediatrics and neonatal समझ आ ही नहीं रही, तो 6 घंटे की है, maybe for that particular subject you can maybe spend a little bit more as far as neonatology is concerned. Having said that, I would say that doing only revision videos for all 19 subjects, if you want a top 5,000 rank, I would suggest that at least फाइव सब्जेक्ट्स शुड बी डन फ्रॉम मेन नोट्स. उतना टाइम है, इवन इफ यू आर 6 मंथ्स अवे, इतना टाइम है कि 5 सब्जेक्ट्स को तुम फ्रॉम मेन नोट्स कर सकते हो. एज फार एज व्हाट 5 सब्जेक्ट्स यू शुड डू फ्रॉम मेन नोट्स, और एटलीस्ट ट्राई टू रीड मेन नोट्स वंस. बार बार नहीं पढ़ने, उतना टाइम नहीं है. मेन नोट्स का रिविजन नोट्स पे ही आना है. बट व्हाट आर द 5 सब्जेक्ट्स दैट यू नीड टू डू? एज फार एज 5 सब्जेक्ट्स दैट यू नीड टू डू, फर्स्ट सेकेंड प्रॉफ में चूज एनी 3 वीक सब्जेक्ट्स दैट यू हैव. कि लेट्स से मेरा एनाटमी वीक है, मेरा पैथ वीक है, फार्मा वीक है, सो दीज 3 सब्जेक्ट्स बिकम लाइक दैट. एंड जो मेन हमारे 4 या 3 सब्जेक्ट्स हैं, दैट इज मेडिसिन, ऑब्स गाइनी एंड योर
सर्जरी.
सर्जरी, इनमें से कोई 2 सब्जेक्ट्स आप चूज कर सकते हो एक तरीके से. These 5 subjects, if you do it from main notes, rest from revision notes, especially like short subjects, for example, and subjects of third prof, like you do from revision notes, add the previous year questions properly and the topics properly to it. And these 5 subjects, you do the main notes and get down to trimming it. You still have a very good chance that you will crack top 5,000 and crack top 1,000.
Yeah.
Definitely, 100%.
So Aditya, there are two,
थोड़ा
three points
exam.
that I have to mention, otherwise I will lose these messages that the students are sending. So one is बच्चे see first control the controllable, do not bother about uncontrollable. This is the philosophy that you have to remember. Winter in Delhi is not in your control. Pollution in Delhi is not in your control. Exam date is not in your control. But what is in your control is to study, right? So always there are people who want to achieve something, and there are people who just want to write down something. There is a big difference. This session is for the students who want to achieve something, right? Not for the student who just want to write it down. So if you want to achieve something, the rule is very, very simple. We will become doer. We will not become sayer, right? And the doer is that you have to learn, you have to study. If you think that you don't want to give 4 months to the TND schedule, you can use the 4 month for 2 revisions. You start, the TND schedule is for 4 months. You have the schedule with you. You start with the first subject and 19 subject, second subject and 18 subject. Instead of 4 month schedule, you complete that schedule in 2 months and do the same revision again, but this time with 19 and 1, 18 and 2. Right?
In
That
fact,
is, you can do that.
that is something similar to what I did, sir. I'll be honest.
Hmm.
Our TND schedule used to be of 8 months.
Yeah.
And I had thought that I have to complete my first read in 6 months. So you will be able to make that. So I knew कि what are the subjects in 7th and 8th month. तो फॉर एग्जाम्पल जब पीज चल रहा था TND इन लेट्स से मई, तो तभी मैंने मेडिसिन भी कर लिया बिकॉज वो एंड में होना था. जब ENT ऑप्थाल चल रहा था तो थोड़ा थोड़ा सॉरी एनाटमी चल रहा था तो थोड़ा थोड़ा सर्जरी कर लिया उस समय. In a way that I was actually able to complete my first read by June, and not June, but मैंने around July end तक मैंने complete कर ली थी, July mid तक कर ली थी. But the actual schedule was probably, so if you feel that the actual TND schedule is 4 months, 5 months, and फिर हमारे पास वो 2-3 revision का time नहीं है, your point is absolutely valid. वो एक आपको एक road map दे रहा है. That thing is giving you a roadmap that okay, in these 4 months, every week these are a test. If you feel that you can, and I know a lot of people who have done their first read, they're very motivated at this point of time, sir, and they are very energetic. And upar se new year, and the new year is also coming. You will be able to complete it if you carry forward with the momentum like I talked about. You will be able to do it in a slightly truncated manner. In fact, उसमें क्या हो जाएगा? Let's say you complete it in 3rd month, for example. तो 4th month का जो TND है, you can actually use it like रिविजन की तरह एकदम यूज कर सकते हो. दैट यू आर स्टार्टिंग विद योर ओन साइकिल ऑफ रिविजन, बट बीच में यू आर गिविंग दैट TND की देखने के लिए कि ओके मेरी कितनी रिकलेक्शन हो रही है फॉर दैट पर्टिकुलर सब्जेक्ट. Like I did my biochemistry earlier, now biochemistry is being done. Let's see how much biochemistry am I able to revise, and what are my weak points that will be covered in the discussion part of the test and discussion, the answers that you get wrong. So 4 month is a roadmap, and you can modulate it according to your own pace and your own understanding.
Okay. Yeah. So next is, can we use this session for INICET? Absolutely yes.
Absolutely. But
Yes,
again, same
100% yes.
100%. The only difference, जैसा अभी बताया, NEET PG, we are expecting probably similar times like last year, like June 15th, maybe July, maybe the first week of August, from
We
somewhere
can
like
mention
that.
that point. A lot of students have written this point. See, as of now, even the people who have to conduct the exam, they do not know what will
Don't
be
know.
the date. Right? So me, Aditya, for that matter, anybody commenting on the date is simply
Guessing.
Guess is a guess
Yes,
estimate, right?
it's a
That is
guess.
how. So nobody, because the person who has to decide the date has not yet decided it.
Hmm.
Now, when somebody will ask when my marriage is planned, somebody's marriage is planned, it has not yet been decided, right? So nobody can, but you can estimate that. And on the basis of, at least I can tell you on the basis of my 2 decades of experience, and specifically this new pattern, specifically after the COVID, that it has happened, the exam happening before May INICET is extremely unlikely. It's extremely unlikely to have the exam before
Where May.
your May INICET.
So
So
we are talking about a 6 month revision. For May INICET, you can truncate it to a 5 month
yes,
revision plan.
correct. है ना? तो you can use it for May INICET also. The rule which Aditya has mentioned is after first reading, you need to have a way of doing 3 to 4 revisions. Correct, right. Now, but that does not mean that somebody is not able to do 4 revision and you will go into that particular FOMO that, oh my God, what has happened? The rule is very simple. Earlier you start, more number of revisions you will be able to do, better are the chances of you to recall. But anybody who has done 10 revision, do you think he will be able to recall everything? Answer is no. It all dependent on your focus, with how much focus you are reading at that point of time. So you have to avoid distractions in your thought. What is a distraction? The distraction is that I am speaking something and you are writing a separate message on that. That is what is called as a distraction. So the rule is very simple. You have to develop that focus. You have to develop that discipline. If it was not there previously, it's a high time you get it now. I am telling you, be it me, be it Aditya, be it any other person who is able to achieve something in the life, or you are at that particular stage, the only and the only thing that will differentiate people is their focus and their discipline. There is nothing called as
Motivation.
I mean, a lot of time people keep on, in fact, even in the morning session today, people were telling me I am a below average person. There is nothing called as below average, average, above average. I have to redefine it. I say below focus, average focus, and more focused person in the life. Everything in the life is dependent on your focus, is dependent on your discipline, and the discipline is very simple. It is about working on the day when you don't want to work. When you want to work, everybody works. If you don't want to work, I don't want to take that particular session today. I have, my friends are waiting for me to have a dinner, but am I taking this particular session? This is what is called as discipline, right? I am very motivated to take a session and I am taking a session. That is not called as a discipline. I am not feeling like studying today. Am I able to study? Right. Now, does that mean I'm telling you the day you will be able to get that particular discipline, the number of days when you feel like studying will become more and more in comparison to the number of days when you don't feel like studying. But initially, discipline needs to be forced and then it become a part of your habit. Then it becomes a routine for all of you. Right. So, first reading, then 3 to 4 revision is an ideal key for you. First reading ideally should be done with complete thorough reading of all 19 subjects, either by recorded lecture or by face-to-face classes or by internet-based live classes or by reading standard textbooks, whatever way that you want to do. It should not have a shortcut. But yes, if you're starting first reading now, then you need to divide them, maybe 4, 5, 6 subjects thorough reading, and rest should be covered with a revision video in the next 2 months. The ideal cutoff date for first reading, upper limit, you can keep it as maybe 28th of February. That's an upper limit that you should try to keep it. Maybe 5, 7 days left and right, but that is how you should keep it. And then if you are focusing on this year, I mean the May INICET or the NEET PG
Need PG.
2026 exam, right? So this is a very simple rule. Okay, chalo, now let us move to the
Sir, one person
second.
had asked, मैं उसको फिर भी आंसर दे देता
Go
हूँ
go
कि
go go ahead,
how
please.
to increase study hours. Here, there are two ways.
Eat, sleep, read, repeat.
Repeat. Very
That's
simple.
all.
अभी your focus, sir ने simply सही बोला एकदम. Sir has said absolutely correctly. There is no such thing as below average, above average, or average. Below focus. You have to get to the focus. Little bit of motivation, I would say, imagine a good life. At least when I used to feel demotivated कि आज पढ़ने का मन नहीं कर रहा, I used to say that if I study today, if I put myself through the pain today, my tomorrow would be better, right? I used to imagine that I'm studying today. If I crack the exam, I'll go for a Europe trip. If I study today, I crack the exam, I'll go on a date with my girlfriend. If I study today, if I crack the exam, I'll so you can always this is visualization मतलब हजार terms use कर रहे होते हैं. People use different terms for this, but visualize a better future. But that visualization will only take place and that thing will turn into reality only if you do the hard work today. And that can serve as an internal yardstick to keep on doing more and more hard work. As far as another thing which I used to use, would advise is Pomodoro Technique. That if you feel initially, if you feel very stuck, you can start with very small chunkets of time with small breaks and gradually increase your time. That you study for 30 minutes, take a 5-minute break, listen to a song, favorite song, whichever it is, then another 20 minutes study, 25 minutes, another 5-minute break, another 20-minute study. And over maybe next 1 week, that 20-minute automatically you yourself will realize has become 50-minute and a 10-minute break. And by 1 month, not 1 month, I would say even by 2 weeks and 3 weeks, it would have become, okay, I'm studying in like, 1.5 hour, half an hour break, 1.5 hour, half an hour breaks. My goal used to be very simple. I'll study for 2 hours. I'll take a half an hour break. I'll study for 2 hours. I'll take a half an hour break. And I'll do this 4 times. And I'm done for the day. That's it. I wake up in the morning, do it twice till afternoon. I sleep and do it twice in the night. That's it. So if you divide your task into these chunks, you will be able to study for more. But the core determinant will, like sir said, will always be your discipline. It will be your focus and discipline. No matter how much I say and you say, करना तो तुमको ही है ना.
Aditya, it is not true for you, but it is very much true for me. When I appeared for an UG exam, UG pre-medical test exam, I had to drop an year. And when I dropped an year, I know that people used, because we are living in a materialistic world. People used to say, "अरे इसके बस की कुछ नहीं है ना? He will never be able to do that." But then when I dropped an year and I got rank 9, the people used to say, "अरे यार ये तो intelligent बंदा है." And when I appeared for NEET PG exam and I got, I mean, we used to call it as a DPG exam. I got rank 1. Then people, oh yaar, he's an extraordinary person. So it's all materialistic. Person is same. How you gonna produce the result is gonna define whether people will consider you as below average, average, or an above average person. Your brain is same, right? So it all depends on that particular discipline. It depends on that focus, right? So Aditya, we have to move to the next point. Otherwise, we will keep, because both of us can speak for, I feel, 5 hours on this particular topic. So the a very important part in your preparation, bacho, is MCQ solving. I mean, there is no escape from it. Um, Knowledge enhancement is important by reading theory, and so does testing yourself. So it's an extremely important part to solve MCQs. Now, there are 2-3 points that I want to speak about MCQs. So, what do you think, Aditya? At this stage, what are the minimum number of MCQs that a student should solve every day?
So I would say around 50 to 100.
Yeah. So I say that
200. That should be the
ideal 100, a minimum is 50.
basically
I will
1
not
hour of
sleep. I will not sleep till the time I will solve 50 questions.
minimum 1 hour of MCQ practice daily is required.
Yeah.
1 hour is 60 minutes. 60 minutes means, well, ideally on the exam day in 60 minutes, you should be able to solve 70 questions. But I'm saying you are starting right now. In those 60 minutes, you should be able to solve 50 questions. At least 1 hour of MCQ practice on a daily basis is required. And obviously, as you get, over a period of time, what's going to happen, you'll enjoy MCQ practice more than reading the theory books. That 1 hour will become 2 hour by itself.
And in the beginning, I want that if you're solving MCQs, you have to make sure that you are not just seeing the answer, you are quickly reading the explanation of that. Maybe in your second, third, fourth revision, you're only looking at the explanation part of selected or bookmark questions. But in the beginning, try to see that why A is the correct answer, why B is a distractor, what could be a possible question that can come from option C, what could be a possible question that can come from D, because I have seen lot of MCQs in the past which have been picked up from the choice of a previous year question. So that's an extremely important area that you have to focus upon. Minimum target that you have to keep in a day that you will not sleep before that is 50, but you have to try to keep an ideal target of 100 questions in a day. Try to make it a habit, try to make it a routine that these are the questions that you're solving. In terms of MCQ solving, I want to add one more point is that you should develop a habit of solving GTs. I am sure that if you are serious about your life, if you're serious about your exam, you're already started writing GTs. But I know that in GTs, there might be different challenges that you are facing. You can write it in the comment section. I always talk about this. Anybody who can tell me what should be the uh, kind of curve that you should get in the GT. What kind of curve that you should get if I am talking about the contrast enhanced MRI curve for a breast nodule? What should be the type of curve that you should get? Yes, can you write it in the comment section? But a lot of students are facing that their GT score has become plateau, right? And you can also mention in the comment that what is a plateau score in dynamic contrast enhanced MRI of a breast nodule characterization called as. But anyways, so what do you think the student should do if the GT score have become plateau? Aditya, what's your view on this?
Sir, I would say that plateauing of GT score is a near 100% certainty. The problem is not the plateauing of GT scores. The problem is students after one or two scores becoming plateaued, they become demotivated and they stop solving GTs. There's a meme na sir that a person is is always breaking some soil and is like and then the diamond is just one more time he does it and the diamond is there. That's the thing. That's what happens. That uh what will happen, some people after two scores being stagnant, they will feel that my score won't improve. They'll stop giving GTs, right? Which is the one of the most heinous crime in preparation you can do, I would say, right? That my scores have stagnated. And so I stop giving it. I get scared of that. For some people, the stagnation might not occur at all. Chalo, they are exceptions. I won't talk about them. For some people, the improvement will occur after 3 GTs. For some, it might occur after 5 GTs. The plateau is a certainty, and the improvement is also a certainty if you keep on practicing. If you keep on practicing. The one single most important takeaway you should take is that 2-3 plateaued GT score should not demotivate you into not giving the next GT.
In fact, no GT score should demotivate you. If you are so called getting a bad score in the GT, it should motivate you further to write another GT. Because if GT is a mirror, you get 101 correct. You think that there is no improvement, it is static, but it is not static, my dear. There is an improvement of 5 marks. Even one correct, one extra correct will give you 5 extra marks, and those one extra correct question will slowly and slowly will improve your score. So does not matter what is your score that is coming up, you have to write the GT. Ideally, when your exam is 6 months away, the minimum number of GT that you should write is one per month. More closer exam will come, you have to write more GTs, right? Two, then increase it to 3 to 4 GTs in a month. But last 15 days, don't write a GT. Specifically, a rank based GT should not be written in the last 15 days. This is a very standard practice that you should inculcate in your daily routine, and this has to be done. I do not want any excuse from the student who believe on us, who believe on our philosophy, that sir, I am not writing GTs because GTs are very difficult. Now, this is another very common excuse that I have started. Your brain will give you 100 excuse not to study. You need to find that one right reason to study. This is the most stupid excuse that you can give me. Sir, I am not writing GT because I have heard from my friend that the GTs are very difficult. But whatever GT that you are writing is even if it is difficult, it is difficult for everyone. How do you analyze the GT is an art, right? So now let us talk about that how to analyze the GT, how to analyze the MCQs that you are solving. Aditya, again over to you.
सर नहीं, एब्सोल्युटली राइट सर. मतलब मैं एक छोटी सी ये चीज़ बोलूँगा दैट whenever you are stuck in this, let's say you feel like कि मेरे को थोड़ी सी improvement करनी है, you can instead of targeting a big win, you can always target for small wins. कि अगर जीटी स्कोर 2-3 करे consistently you feel are मतलब stuck, what you can do is that maybe give a very जो subject you are strong at, उसका एक subject wise test दे दिया कि नहीं मेरे को आता है, ऐसा नहीं है नहीं आता. दैट विल काइंड ऑफ मोटिवेट यू कि डोंट बी अफ्रेड ऑफ द टेस्ट्स इन द फर्स्ट प्लेस. द सेकंड थिंग दैट यू कैन डू इज फ्रॉम द जीटी itself, although that's a very, I will say that's a totally different video sir altogether, GT analysis and how to improve GT scores, but at least from the GTs try to find out what are your weak subjects which you tend to forget more and more. And next GT may at least just like don't directly give the GT. Maybe before you start giving the GT, 2-3 hours before that, revise that particular subject which you are weak at and revision points of that from the revision notes that you already have, right? So at least, and if you see a boost in that, you at least know, okay, it is a recallability error and more revisions will solve this recallability error rather than a conceptual error. If it still doesn't improve and okay, now conceptual errors are occurring, then go back to the concept videos, main videos, and try to improve that concept. That if you're, let's say, always getting, there are 3-4 questions, let's say, on ECG, and you're getting all questions incorrect on all, like, for 3 consistent times, then maybe actually watch the videos. Next time it will happen. Let's say in anatomy, you are forgetting what are the derivatives of the aortic arches and every time. Next time, then revise. In that time, you don't need to watch the video of derivatives of aortic arches and everything. You just probably need to revise it and give the exam next time, like that. So that can give small temporary boost, and over a time, I would say that these boosts accumulate for the final 10-day revision. If you do that 10-day revision thoroughly and you have material for 10-day revision thoroughly, you're anyways ahead of the of 90% of the competition.
Yeah. Tanya has asked a very important question. I wanted to take up that, and it is that, sir, and in fact, not Tanya, many more students who have asked this. Those who completed everything last year and got a mid rank and now are stuck, what would you recommend for them? Yeah. So, I mean, it's a very, 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 very important point. Um, you need to first analyze that what was the reason for your mid rank. Was your incomplete study that was the reason for mid rank? Or you did your first reading thoroughly, but you were unable to revise the subjects properly, or you got lost, you got deviated from your preparation. Rather than reading thoroughly, you got into this thought ki chalo I will do some magic and I will get a rank, right? So if that was a scenario, then you have to start all over again. But if you have done your first reading very, very thoroughly, consider it you as a group 1 or a type 1 student who has done the first reading, use the notes, back it up with the TND program, make sure that you are revising the subject well, make sure that in every test you are keeping a target that you are minimum 75% you are scoring. um, I mean, more you score, the better it is. What are those 25% questions that you are unable to answer? Was it your lack of knowledge, or was it your inability to apply the concept that you have learned? Right? Look at those areas. Don't get disappointed because you have committed a mistake. Rather, focus on this, that how to work on that, right? I still remember, there is, for me, there is a very, very big motivator. I always talk about her in my classes, Arunima Sinha, who is a amputee volleyball player who climbed Mount Everest. With one limb, she was able to climb Mount Everest. And after this, when she received the President Appreciation Award, she made a statement, and that is everything is thought process. If there is a wall in front of you, there are two options that you have. You just think that there is a wall around me and now I can't do anything. And second, you develop a way that how you can climb the wall and go to the other side. And it's all your thought process. So this is the same thing with the GTs also. If you're doing it wrong, analyze it, that why you are doing it wrong, where is the mistake that you are doing. And that is an area that you have to improve upon. Is it a lack of knowledge? If it's a lack of knowledge, you have to improve your knowledge. Is it the inability to solve the MCQ?
Lack of
It's your inability to apply what you have read. If your inability to apply, first focus on that. Because then there is no point improving the knowledge without knowing that how to apply that knowledge. Right? So that is why the student who are scoring less than 130 correct in the GT, they should not run for learning more. They should first focus on getting that, because that's a basic content that is available at any place, at any platform. Once you're able to do cross that, then you should focus about the so-called DM level question, difficult question, tricky question, twisted question, whatever name that you want to give them. But everybody has to learn to analyze it. Everybody has to learn to identify it the way that you are doing the mistakes, right? Aditya, before we end, I have a very important question for you, which is almost a part of every session that we take. How to make 20th notebook?
सर बेसिकली 20th नोटबुक इज अ मैंने 20th नोटबुक नहीं बनाई थी. व्हाट आई हैड डन वाज एसेंशियली मेरी 20th नोटबुक मेरी फर्स्ट एड थी. तो फर्स्ट एड के ऊपर आई वोंट कमेंट अपॉन फर्स्ट एड बिकॉज दैट अगेन बिकम्स अ डिफरेंट वीडियो. द कंसेप्ट ऑफ 20th नोटबुक इज वेरी सिंपल. 20th नोटबुक, शॉर्ट नोट्स एंड एवरीथिंग. इट इज दैट लास्ट 10 डे में आपको ना रिवाइज मारना है. ऑन द लास्ट 10 डे आई वुड रीफ्रेम इट सर. 20th नोटबुक कैसे बनाए? द बेटर क्वेश्चन इज हाउ डू यू रिवाइज इन लास्ट 10 days.
Yeah,
The question is not
actually,
20th. The
see,
question is मतलब मैं वही बोल रहा था.
20th notebook is just a name.
Name.
We used to call it as how to create our wall,
Wall.
right? And when these internet-based
सारा
things were not available, yeah. So
exactly.
it's a crisp revision material.
But how to have that crisp
Yeah.
resolution rate.
Right?
So
So
what
whatever you want to call it as, you can call it as. But I mean, I love the statement which Aditya makes in every video is about um, your ability to revise everything in the last 10 days. My senior used to say, and I still remember his statement, more number of topic, more close to the exam you can revise, better will be your rank. Anything that you have read
definitely
in the last 10 days, and if it is that thing that is asked in the exam, the chances that you will
you
be
will get
able
it.
to get it right is much, much more in comparison that you have read it 6 months before the exam, right? So more volatile a point is, more close to the exam you should be able to you should able to read it. That's all. This is the broad concept. Anything that you are likely to forget or you are doing it wrong repeatedly should be learned very, very close to the exam. And that is a simple concept of last week revision, 10-day revision, 15-day revision, 20th notebook, wrong copy,
20th notebook
whatever name that you want to give it, right? So that's
you
a
want to call
very,
it.
very simple
That is
point.
the basic concept. For every subjects, the PYQs, and most importantly in those PYQs which are volatile PYQs for you. कि जैसे pediatrics है, for example in pediatrics you'll be like, sir I understand growth, मेरे को growth आता है, समझ में आता है and everything, but I forget developmental milestones. So you keep that in the last 7 day revision. Keep PTs में I have to do developmental milestones. I understand UNITO broadly I understand UNITO, but forget the NRP protocol. So I won't do the entire neonatal resuscitation, but at least the NRP protocol, that flowchart, I will definitely do. Similarly, if I move forward in systemic pediatrics or for that matter, medicine and everything, for example, right? I understand the flow volume curves, but I tend to forget about, like the stroke syndromes. कि stroke syndrome में कौन सा ipsilateral है, कौन सा contralateral. So you keep that. For every subjects, the important past 7 to 10 years, 5 to 7 years, whatever PYQs, plus which are volatile. If you revise that in the last 7 day and give the exam, you're sorted.
No, absolutely correct. Aditya, I'll take this last question. Kosh P4K has asked, um, should I leave my job stat or can continue for 1 to 2 months? Right? तो बच्चे देखो, मेरा बहुत ही very very straightforward view that I have on this. When your focus is about preparing for the exam, the biggest reason that you are doing a job is a financial
Hmm.
compulsion, right? Control the controllable, don't bother about the uncontrollable. If you have a financial compulsion, you know that you are not from a financially sound background. You have to take care of your own finances, and because of that, you have to do the job. I will say, keep on doing the job till the time you're able to sustain yourself and you're not being dependent on anybody else, right? The second reason is that you are not financially dependent on the job. You are sorted. You're broadly sorted. You have enough finances to sustain yourself, to take care of yourself. But you want to do the job to maintain a regularity, right? It gives you a discipline in the life. Then this job should be one that is not giving you stress, right? Because your mental peace is also very, very important. It should be a job that is giving you a pleasure of working, could be for 3 to 4 hours in a day. If it is for 10 to 12 hours in a day and continuously for 4 to 5 days, this is definitely going to compromise your preparation. Definitely going to compromise. So financial compulsion should be the single most important reason for doing the job, and try to do, and specifically when you are taking a drop and when your primary focus is to get into PG. Yes. Uh, if you think, if I would have been at your place, I would have done a job for 2, 3 months, even for a financial reason, to get a reasonable financial
Corpus.
corpus for me, and would have used this particular corpus for the next 7 or 8 or 9 months. And immediately after the exam, I would have joined the job
Job.
again to take
So
care of
I'll
the
give my
expense.
perspective. So because I did a non-acad job, I did non-acad GRship when I was preparing for my May exam. So I'm not someone who requires a job, very honestly. मतलब I did come from a very decent financial background, but सिर्फ वो थोड़ा लड़कों में होता है ना कि इंटर्नशिप के बाद पेरेंट्स से पैसे मांगने का वो नहीं होता कि मांग सकता हूँ, एंड मेरे पेरेंट्स बहुत कैपेबल थे टू लाइक दे बिलोंग टू वेरी वेल टू डू फैमिली, ऐसा कुछ नहीं है, बट वो खुद में ही था. सो माई थिंग वॉज दैट आई विल डू इट फॉर 2 months. In 2 months, I will earn. I had a 75,000 की समय job थी. I'll earn 1.5 lakh, and this 1.5 lakh can sustain me for next 10 months. महीने के 15-20 हज़ार रुपए खर्चे हैं on the higher side, right? तो if it can sustain me for 10 months, next year's NEET PG भी निकल जाएगा and everything. So for Kaushik, my simple advice is, if the financial compulsion is there, and do it for 1 to 2 months or maybe 3 months, till the time you have enough, like sir said, उतना corpus एक बार आ गया, if you get that much amount of corpus, that you can then drop it and then maybe prepare. I did continue till my exam actually, for the second reason sir told, that by the time I had was in the job for 2 months, it was not a hectic job. I had to just go from 9 o'clock in the morning to 2 to 2:30 in the afternoon. It was a five. So it ensured discipline for me. It ensured that I wake up at 8:30 in the morning. I go for the job. I reach by 9 o'clock. By 2 o'clock, I'm done with it. It was not a hectic job. It was more, I was in lab medicine, right? It was mostly a sitting and desk job for me. And by 2:30, when I used to get free, I was like, I was in a groove to chalo, I study again. Even then, the last 1.5 month, I did not go. I took leave without pay. So I basically did the job for 3 months, 1.5, 2 months I did leave without pay. Then again I started the job all over again. So this is something which you can, matlab, you can obviously model around it. If the financial compulsion is so strong that you need to keep on doing it, then try to find a job, I would say, which allows you more time to study.
Yeah. So, I mean, these are the points, and I'll just quickly summarize in the next 2 minutes about what we have learned in this. If you have 6 months for your PG entrance exam preparation, it's a decent amount of time. You can completely revamp your preparation, but first identify that in which sector you are. Are you a type 1 student who has already completed the first reading, or you are still in the middle of the first reading or about to start fresh, right? If you are in the first reading, try to start the revision with the TND program, DBMCI Live or DBMCI 1 TND program, which is a live internet-based classes, is a very good option for you to revamp your concept as well as your preparation. However, if you are in the uh, category of the student who are doing their first reading now, then try to truncate it by doing thorough reading of 4, 5, 6 subjects. You can pick up 3 subjects from pre and paraclinical and 2 subjects from medicine, surgery, and OBG to make it a basket of 5 subjects that you have to read very thoroughly, and the rest of the subject should be done with a revision video. 20th February or 10th of March should be the time when you should ideally be ready to finish your first reading as an upper limit and start with the revision. If you want to do quick revision, any schedule that you have, you can multiply it by 2 and you can reduce the days to the half. You have to make sure that you are solving MCQs, minimum of 50 MCQs per day. Ideally, the target should be 100 MCQs per day that you should write. You should also write GT, 1 GT per month. If the exam is 6 months away, but we are in that window, so try to write 2 GTs per month at this stage. Don't bother about the toughness of the GT. Don't give these excuses that these are the tough GTs. Wherever you are going wrong, wherever you are forgettable stuff, make sure that you are creating your wrong copy, 20th notebook, last 10-day revision material, LMRP, whatever you want to call them. You want to write it separately, you want to annotate it in the your own notes, or you want to use first aid to do them, whatever that you want to do, you can definitely do that. Um, if you are repeating the year because of a mid rank last year, try, if your notes are complete, again try to back it up with the TND program, and it is going to be a very very big boon in your preparation, right? That's all from our side. And do let
Kaushik had
us
asked one
know.
more question ki how I jumped from 1700 to 17. Kaushik, I'll respond it on my own channel. आज थोड़ा थोड़ा जनरल कर लेते हैं. It's a very specific question because मेरी जर्नी अलग हो जाएगी. But I'll respond to your question definitely.
Okay. All right. So that is all, guys. Thank you very much for your patient listening. And do let us know that if we can do anything else for you. Right. Good night, and may God bless you all.
Thank you.